The surgical procedure has been completed with absolute success. For a patient, there are moments when this exact phrase can feel like the most cruel thing to hear. This happens when, despite undergoing fat repositioning, the dark circles remain clearly and visibly etched under the eyes, simply because many surgeons carelessly declare it a success based solely on the fact that they managed to relocate the fat. However, what is vastly more important than merely executing surgical techniques is achieving the bright and refreshed eye area that you truly desire. At ST Plastic Surgery, we maintain a profound understanding of these exact frustrations and the psychological burden they carry. If you carefully examine the clinical case of this particular patient, the meaning behind our philosophy will become entirely clear. This is the medical case of a female patient who is currently in her mid-40s. For her procedure as well, we proceeded with the surgery utilizing a partial incision made carefully through the inner conjunctiva. She was previously told at another clinic that dark circles are a secondary issue and should be treated separately elsewhere. However, if a clinic truly possesses top-tier, global standard technical skills, dark circles must be resolved simultaneously during the surgery. What is absolutely required is the specialized fat concealer technique, which involves spreading a remarkably thin layer under the skin to correct the pigmentation. This patient presented with a complex combination of deep tear troughs, prominent dark circles, and visibly bulging fat that remained under the eyes. At this critical juncture, the single most important objective is to completely release the structural tethering of the tear trough. We must definitively release the retaining ligaments of the tear trough, carefully pass the solid fat mass down below that specific groove, and meticulously anchor it to the periosteum across 5 distinct fixation points to ensure an extremely robust and secure hold. In standard, conventional surgeries, the tear trough ligament is left entirely intact, and the procedure only addresses the superficial surrounding areas. When that flawed approach is taken, the underlying hollow depressions and the stubborn dark circles inevitably remain exactly as they were. In sharp contrast, our specialized fat repositioning technique involves dissecting much deeper below the tear trough ligament before securing the fat, which significantly expands the surgical scope and directly results in a definitive, uncompromising difference in the final aesthetic outcome. Please observe the before and after comparisons. Whether the patient is looking upward or naturally smiling, you can clearly see that the harsh boundary line between the bulging fat and the deep tear trough has been completely eradicated. Over this smoothed foundation, we meticulously layer specially processed fat directly beneath the skin to fundamentally improve the dark circles. To guarantee that the fat introduced under the delicate skin never forms unnatural lumps or undergoes severe calcification, we employ our clinic's exclusive custom fat grafting protocol, which processes the tissue into an exceptionally smooth and flawless consistency. If you closely review the video footage, you will notice that even when the eyes are fully closed, the contour is remarkably natural, and you can verify that the way the light reflects off the skin has been beautifully and evenly restored to its optimal state.